Hey guys, Dr. Will here from Miami Spine and Performance in Hollywood, Florida. Today I'm here with Annabelle. She has traveled here all the way from Colorado to get some treatment. Annabelle is a busy working professional. She spends a lot of time at her computer doing meetings and things like that. So she's been telling me how she's dealing with a little bit of neck pain and a little bit of upper back pain. She's also fairly tall, so taller people just have a little bit of a harder time staying upright. Gravity tends to get the best of them a little bit, so she has a little bit of a postural issue in the upper back, and that's leading to some tension up in the neck. Additionally, she does weight training and running, so she's putting a little bit of additional stress on her body. So we're going to start out and just kind of scan everything, see what's going on, and then get her adjusted. So are you having any pain today, Annabelle?
A little bit right on the...
Up in the top?
Yeah.
Okay. You get headaches at all?
Yeah.
Headaches, yeah. So a lot of times we'll see headaches being a combination of postural issues, but also looking at a screen, so it kind of irritates the eye, and that can lead to headaches and things like that. Have you considered quitting your job? No, I'm kidding. That might help. All right, so with Annabelle here, what I'm feeling is a lot of stiffness kind of through the mid-back. Again, the typical problem issue for most people. The middle of the neck actually is a little hypermobile, which again in like younger females is pretty common. And then up here is just really jammed up. So that's a lot of times that forward head posture just pinching on these nerves back here. And then lower back, she has a little bit of an accentuated curve. Again, young female, typical pattern, a little overextended. And then just some tightness kind of through these mid-thoracic as her body's trying to find some mobility there. So let's have you start face up, please. When was the last time you were adjusted?
A year ago?
A year ago? Yeah, it's been a while.
Yeah.
So she is 11 months overdue, I'd say. So we're gonna get her fixed up today. So as usual, I'll start with kind of the mid back here. So we'll just do thoracic roll. I'm actually gonna go a little lower. We're gonna do the TL junction to start. I'm just gonna come all the way over. Nice. And all the way over here. Perfect. So we just moved the TL junction and then the upper thoracic. Go ahead and line your right side, please. Now we're going to see what's going on with the SI joint. So typically in these younger females that have that extended lower back, typically you'll see the thoracolumbar junction, so where the mid back and the low back come together, as well as the SI joints get a little bit out of whack. So that's what we're going to check today. Bring your hips towards me. Any lower back pain or anything?
Not really, no.
Do you want lower back? No, I'm kidding.
Mostly just upper back pain.
Yeah. Again, guys, the whole spine works together, so just because an area is not painful doesn't mean there's not some dysfunction there. So we treat the full spine here at Miami Spine and Performance. So just like a little restriction there on that left SI. So I'm just going to roll her in this way. Big breath in. Breathe out. Keep going. Nice.
Uh-oh.
That's an adjustment that's 12 months overdue. Come this way for me.
Onto this side?
Yeah. So putting that SI joint in a good spot is going to allow her to run a lot better. It's going to help her mechanics of running so that her pelvis is able to rotate properly. It's going to make her more comfortable while she's sitting. Come this way for me. And I think, that was such a big adjustment. I think that even the right SI got reset a little bit because there's not a lot here. We'll probably just do a little drop on this side. Same thing, come all the way in. So one thing you guys will notice is I'm actually going to flex her a little bit because like I said, she's a little overextended. So we'll do a little bit of flexion. Bring her home. Nice and easy. Good. Go face up for me. So a lot of times with those SI joint restrictions, we'll see the feet get a little out of whack as well because when there's improper mechanics of the pelvis, it kind of leads to either too much weight being put on one foot or too much weight being put on the inside or the outside of the foot. So just going to check the feet here. Just a little restriction there. There we go. Same thing here. Nice. So it kind of makes sense, right, guys? So left SI joint locked up, left foot locked up. So the body tells the story. So now we're going to get to our problem area, which is going to be the neck. So we're going to start with just a little bit of traction here. So pick the pillow up. So you're just going to lay your head in here, Annabelle. So all this is going to do is just create a little bit of decompression in the spine. Again, you're sitting all day, you're fighting against gravity. It tends to put pressure on your spine and your discs. Even for someone that's young and healthy like her, if we can just create a tiny bit of space, a millimeter of space in the spine, it's going to make for a much happier and healthier spine. Tie that up there. Let me just grab this guy. So we're just going to do a gentle little traction.
Okay.
Nothing crazy. Just relax your head. So this is a way of just unweighting. Again, you know, if you're sleeping, let's say 8 hours a night, 16 hours a day, gravity's pushing down on the top of your head, and it's creating some axial compression of your spine. So if we can just take a couple minutes to decompress the spine and get some axial decompression, that can make a world of difference. Sometimes people will even feel a little bit of like a stretch all the way down to their mid or lower back with this, just because of how compressed things are.
Yeah, I feel that.
I'm gonna pick the head up here. So again, guys, typically if we were filming a full office visit, I would get in there and kind of work on these suboccipitals, probably work on the upper traps as well, do some soft tissue work, which we'll do here after the adjustment. But I'm already feeling upper right side.
That's very tight.
Yeah. So I'm feeling some upper right side stuff. So that's the occiput. So we are going to have Annabelle turn her head, jut your chin out a little, and open it up. There we go. This one's like C2,
Yeah,
very typical. So this one's going to be a little different, just a lateral break right at C2. Nice and easy. All right, guys, there you have it. Another happy customer. Like I said, during a typical treatment session, I'd go in and we'd do some soft tissue work now, maybe get her on the flexion distraction table. But from an adjusting standpoint, every visit's different, every patient's different. Scan, find the problem, fix the problem, and usually that leads to a happy and pain-free patient. So thank you for watching, guys. Don't forget to hit the like and subscribe button.